From hemoglobin to human genome, what are the new perspectives in medicine?
Well, that's a very, very large question. But since you mentioned hemoglobin, yes, I think that, as I mentioned in my talk, hemoglobin was what the trailblazer to tell us about molecular medicine. It was the first disease called the molecular disease. Interestingly, it is also true that one of the first conditions to be successfully treated by gene therapy are hemoglobinopathies, which by now includes both severe beta thalassemia and sickle cell anemia. So that is a good continuation of the story.
How gene therapy can modify the management of genetic diseases like thalassemia?
Well, as I've just mentioned, it can modify because it can virtually cure the disease. So the phrase that you quoted, disease modifying, is now very fashionable. There are drugs that can just stem some of the symptoms, and there are drugs that are actually called disease modifier. I would say gene therapy is the extreme disease modifier because when it is successful, it actually eliminates the disease.
Is the study of somatic and stem cells changing the knowledge of cancer?
Yes. I would say that on simple reasoning, we already knew that somatic mutations are important in cancer. For once, I will be a little bit immodest. I published an article in 1993, I think it was, where we said leukemia is a genetic disorder of somatic cells. So at that time, I remember the editor told me, "Isn't that too bold?" I said, "Well, title, please leave it as it is." Now, that same title would be simply first-year medical student teaching. So in 20 odd years, what has been the difference? The difference has been that it was a notion, but now we can pinpoint those mutations. As we heard this morning, exome sequencing or genome sequencing has become a realistic possibility. So we can say in this tumor there are these mutations. So yes, I think it is a phenomenal progress, and of course it's only in some cases that this will directly affect treatment, but I think that these cases will increase as we can target more of these mutations.
Is medicine a service or is medicine an industry? I'm talking about orphan drugs, of the access to therapies for different people in different countries.
Well, thank you very much, because clearly your question is a bit tailored to what I was trying to put across, and I think it shows that you understood very well. So you asked three different questions. One is a concept. Is medicine a service or an industry? Now, to me, it is a rhetorical question. I believe that a civilized country should offer proper health services to all. And I think that in Italy, where we have an addiction to speak badly of our country, we should not be blind to the fact that our underfunded National Health Service is actually one of the best in the world. And I think that we should be proud of it. The fact that it is a service does not mean that it doesn't use industrial products. Of course, advances in devices and in drugs do come from industry. But in principle, I think that we should make a political choice. And this country has made a political choice. I hope it will not be reversed. Other countries still have to choose. They have something of a hybrid system. And other countries have a totally private industrial. And it's significant that, for instance, the United States, I'm told that the fastest growing industry is the pharmaceutical industry. Pharmaceutical industry is not all of health, but it is a very important component. And I think personally that the prices of drugs cannot be looked like the prices of a car, because with cars I have a choice. If you are rich enough to buy a Ferrari, good luck. Most people buy a Panda, and I came this morning on a bicycle. But there is a choice. With health, if you have a serious disease and there is only one medicine for that disease, you have no choice. And therefore, I think that should be part of the policies on how health is run and how prices are regulated.